If you've recently suffered a wrist sprain, I'm going to show you some techniques that can reduce pain, improve strength, and return function. A lot of times when we sprain our wrists, these are when we have irritation or stretching or overstretching of the ligaments in and around the wrist area. So what we're going to do is we're going to start with basic stretching. Now with this, be careful because remember, the ligaments have already been stretched, so we're going to be easy with our stretching, just trying to restore some of that normal movement. So what you're going to work on first is going into extensions, just pulling the hand back, the wrist back in this position here. You're going to hold that for around 20 to 30 seconds and relax. Pull it back again. Hold this around 20 to 30 seconds and relax. Repeat that several times just throughout the day. Remember, if it's too painful when you pull back or you feel too much of a stretch there, back off a little bit. Don't pull it down as far. Then we're going to go into wrist flexion. So I'm going to bring the wrist down in this position here. So you're going to pull down. You may get a little pinch here, maybe a little uncomfortable, so don't really force this one. Hold this again, 20 to 30 seconds and relax. Pull it down, hold again, 20 to 30 seconds and relax. And just repeat that one several times a day. Another technique is going to be a joint distraction technique. I really like this technique. It works well at modulating or reducing pain. So what you're going to do is this little bump that you feel right here, that's the outside of the ulna here. You're going to go right below that and you're going to pull down. So I'm pulling my hand down away from my forearm. I'm going to pull that. I'm going to hold that for around maybe 5-10 seconds. You can oscillate that and kind of pull it back and forth. That's fine. But a lot of people just like to hold that static traction on that. That's a good distracting joint mobilization that feels pretty good. Repeat that several times just throughout the day. Next, we have to start loading that tissue. So we're going to take a dumbbell. We're going to prop our forearm up here. You can use a towel or just whatever you have to prop it up. If you don't, you can let it hang off the end of a table or end of the bed or whatever you have. So what you're going to do here is you're going to go into wrist extension. I'm pulling my wrist back into extension as far as I can and then slowly lower it back down and pull it back nice and slow. Really squeezing all these muscles up here in the extensor group here and come back down. Repeat that for 2 to 3 sets of around 10 to 12 repetitions. Next, we're going to flip over and go into wrist flexion now. So we're going to just curl that dumbbell up. You're going to feel this in the flexor mass here, my forearm. And so you want to really tighten that up and squeeze that at the top. If that's too uncomfortable, either use a lighter dumbbell or you can just not go as far. And with this, I'm using a 2-pound dumbbell. You can start with a 2-pound or 1-pound. You can get heavier, that's fine. Eventually, you do want to get to a heavier dumbbell. But I'm just working with a light dumbbell I can control right now, and it's not too painful. Repeat that for 2 to 3 sets of 10 to 12 repetitions. The next one we're going to work on, this one can be a little difficult, and you may have to wait a few days before you can really start working on this one because this can be a little painful. We're going to go into what's called supination and pronation. So that's that rotation back and forth of my forearm here. And you're going to go all the way over and then back. As you become a little more confident with that and the pain gets better, you can hold the dumbbell down at the bottom and you can do it this way. That's going to make that more difficult. And you're going to go back and forth, repeating that for 2 to 3 sets of 10 to 12 repetitions. Next, we're going to use these finger extension bands. I really like these. These are by AlphaGripz. I'll put a link in the description for these, but you're going to go back here and just really pull your fingers apart. You're going to feel this down into the forearm. This works those extensor muscle group really well. You're going to perform this for 2 to 3 sets of 10 to 12 repetitions. Now kind of flipping over and going back with finger flexion. So this one you're going to use a grip or hand grip trainer. And with the resistance on this, I want it such that at about 10 to 12 repetitions, it's pretty difficult. And I'm going to go in there, 10 to 12 repetitions for 2 to 3 sets. It does really well. I'll also put a link in the description for one of these. Now we're going to start working on some weight bearing techniques. What you're going to do is take a small ball. If you don't have a ball, you can fold up a towel. That works really well. Put it on a stable surface. You're going to put your hand down and kind of work on pushing down into the ball. You can stand and do this. That's fine as well. You can stand and do this or just lean over and just work on loading that joint. Maybe holding that for around 3 to 5 seconds and then relax. Go back into it again. 3 to 5 seconds and relax. Repeat that for a couple of sets of maybe 10 to 12 repetitions. Next, we're going to work on tennis ball tosses. You're just going to take the tennis ball, toss it up, and work on catching it. Now, initially, you're going to be really easy with that. You're not going to toss it very high, just to work on kind of that coordination, return of motor control. Then you can work on bouncing it off the floor and catching it, or throwing it against a wall and catching it, just really kind of varying that up. You can start to really progress with your overall program, with your resistance training, as far as the weight that you're using. I typically have patients start to do that at around 3 to 4 weeks. We're starting to really advance things because I'm trying to return them back to either daily life or back to return to sport. Lastly, one of the things that you can do really throughout the program is using either moist heat or you can use ice packs just throughout, whichever you prefer. Typically, after an initial sprain, I have my patients use ice for about the first 48 hours. After that, I really leave it up to them if they want to use ice or heat. We're going to have the patient stretch all throughout the program. We're going through light stretching and that joint distraction technique that we used before. We're going to go through that the whole program and just kind of maintain the mobility. But again, you can always use any of that ice heat. Some people use home TENS units, those different things. As long as you're safe to do that and cleared by your doctor, you can always use all of those things as well. Hope this video helps to improve your symptoms after a wrist sprain. Make sure you hit that subscribe button so you can stay up to date on all my content.